and welcome back to another episode of Sam Studies Sesh. As you can see, today we will be exploring the disease of hyperthyroidism. Hyperthyroidism is a pathological disorder in which excess thyroid hormone is synthesized and secreted by the thyroid gland. It has multiple etiologies and manifestations, however, the most common cause is the autoimmune Graves' disease. Since thyroid hormone is responsible for regulating many of the body's processes, such as metabolism, an overproduction of them can therefore have wide-ranging effects across the body. So in order to understand hyperthyroidism, we must firstly look at the normal physiological processes that occur, including the hypothalamic pituitary thyroid axis and all the hormones involved. So let's take a closer look. Under normal conditions, the hypothalamus in the brain releases thyrotropin-releasing hormone, or TRH, in response to a range of stimuli such as stress, illness, or metabolic demand. TRH then stimulates the anterior pituitary gland to secrete thyroid-stimulating hormone, or TSH. TSH will travel in the circulation and target the thyroid gland, which is a butterfly-shaped gland located near the base of the neck just below the larynx. So TSH will bind to the TSH receptor and stimulate the gland to release two types of thyroid hormone, which are thyroxine, also known as T4, and triiodothyronine, also known as T3. An increase in T3 and T4 will have a direct negative feedback on the hypothalamus and anterior pituitary gland to inhibit the release of the two upstream hormones. The thyroid hormone affects nearly every cell and organ in the body. They play an important role in regulating many of the body's processes, including metabolism, energy levels, appetite, body temperature, heart rate, and muscle tone. It is this diverse range of effects that account for the numerous and varied symptoms of hyperthyroidism that we will explore shortly. There are many causes of this disease, including toxic multinodular goiter, various forms of thyroiditis, and sometimes, more rarely, pituitary adenomas. These are just a few causes. However, for today, we will just be focusing on the autoimmune disorder Graves' disease, the most common form of hyperthyroidism. In Graves' disease, the body makes abnormal antibodies that are directed against thyroid follicular cells. However, rather than marking these cells for destruction, as antibodies normally do, these so-called thyroid-stimulating autoantibodies, or TSABs, mimic the action of TSH and increase target organ activity. So these TSABs bind to the THS receptors on the thyroid gland, stimulating it to increase the production and release of thyroid hormone. This mechanism occurs independently from the negative feedback axis we talked about earlier, so reducing the levels of TSH will not have any effect as the TSABs are still present and will keep stimulating the release of more thyroid hormones. And so therefore, an elevation of these hormones and their effects is known as hyperthyroidism. So now that we know the pathophysiology of the main cause of hyperthyroidism, let's go explore some signs and symptoms of this condition. Keeping in mind the various functions of the thyroid hormone, in hyperthyroidism, where there is excessive amounts of thyroid hormone, it promotes a hypermetabolic state, which is characterized by sudden weight loss, fatigue, increased appetite, elevated heart rate, restlessness and irritability, muscle weakness, and excessive sweating. Other symptoms that are more common in Graves' disease include goiter, an enlarged thyroid gland, and ophthalmopathy, which is swelling of the soft tissue around the orbit, leading to protrusion of the eyes and dysfunction of the extraocular muscles. In 2016, it was reported that Australia had a hyperthyroidism prevalence rate of 0.3%, which is slightly lower than in the United States and across Europe. Hyperthyroidism generally increases with age and is around 10 times more common in women than in men. And although there is limited data for ethnic differences, it seems to be slightly more frequent in Caucasian populations. Among patients with hyperthyroidism, around 60 to 80% have Graves' disease, which, as we learned before, is the most common form. So that's all we have today on hyperthyroidism. Stay tuned for another episode of Sam Studies Sesh. See you next time. Bye!